They currently are at that exact moment when you drew the blood. Okay? All right, age. We're going to put her age in here.
She doesn't have one.
She doesn't have one, so we'll make her 2 years old, okay? You can choose years or months, whatever it is, and then it will automatically give you a life stage. The life stage is what constitutes or helps the computer decide what the normal range is going to be for that patient, okay? Bless you.
Thank you.
So once we have all that information filled in, then you're going to go ahead and hit next. One important thing before you hit the next one is that you make sure it's on the main screen down here, because if it is not, it will not transfer properly to the vet test machine, and then you get to start all over.
Yay.
Yay. Okay? Next. Okay, so on our next screen, it's got all your patient information up here, and then it's asking for the reason for testing. So most likely for surgery, it's going to be for routine surgery, okay? If they're sick and they're here, then you can monitor, choose that, whatever you're running it for, okay? And then we also have to choose the machine or the test that we're running. So down here on the bottom, we have in here the vet test, and then there's a bunch of snap tests. There's machines that will also read snap tests. We just have our vet test hooked up to it, so we're going to hit vet test. All right, and then it's going to come up with this little box called dilution. What this is used for is, let's say I run a test and my ALT is through the roof and it's reading high. It's not even giving me a number. That is very difficult for us to assess. What we will do is we will go and dilute the sample with sterile water, okay? And then you're going to note what your diluent is. Okay, so if it's 1 part your diluent to 1 part your blood, you're going to put 1 to 1. If it's 2 to 1, you're going to do your 2, so on and so forth, however you need to dilute it. Okay, that allows the machine to recognize and give accurate results and numbers once it spits out the results. Okay? All right, so we are not diluting, so we're going to hit our run button here.
Will we ever dilute here?
We may. We haven't really had to because we haven't had results that high. The only time you're going to dilute is if it's not giving you actual results. Okay? All right, so we're going to wait a minute. It's going to transfer its information down to our vet test here. All right, so once it comes up with this screen, you're going to make sure that it's accurate. We have Millie's name here. It's got the ID number, the USDA number. Everything is good there. If I had client first and last name in here, it would also give me that, but we didn't do that. We just put in the rescue. All right, so it says C to cancel, E to continue, so we're ready to continue. We're going to press E. And the nice thing about this machine is it is idiot-proof. You can't screw it up. You shouldn't be able to.
Accepted.
Let me correct myself. You shouldn't be able to screw it up.
Challenge accepted.
Okay?
Got this.
Okay. All right, so now the screen says insert each side separately, maximum of 12, and you're going to have the barcode facing up with the nick on the left edge. Here's the nice thing. I'm going to open. Okay, do we have any of the, I'll just open one, and then we'll refold it over so we can use it next week. So when you open it and pull it out, one important thing is that you do not touch the circle on either side, okay? That is what is actually going to absorb your solution or your serum or your plasma, whatever you're running. If you touch it with your fingers, it will absorb your oils, then therefore not absorb the material properly and throw off your results, okay? And then we're going to stick it in this little box here. There's a little notch here. It can only go in one way. Okay, I repeat, it can only go in one way. So we're going to put it in with the little notch. I'm going to make sure this is empty real quick. Yep. That's your little garbage container there. Okay, we're going to take a little black handle, push it in, pull it all the way out. And when I say all the way out, make sure it's all the way out. Sometimes when this thing starts up, it'll be screaming, ah! Check this little handle. If it's pushed in a little bit, it makes it mad. So just pull it all the way out. Okay? And if you guys heard the little rotation sound, that means it's ready for its next one. So then you can put in all of your samples or all of your codes. And once you're ready for that, then you're going to go ahead and press your enter button. If you're doing a full general panel, which we'll do on our older patients or patients that have elevated levels on our pre-anesthetic, it will automatically go to the next page once you've got all 12 in, because that's all it will accept is 12. Okay? In general, all of our patients are receiving pre-anesthetics unless Dr. Katie or myself or Megan otherwise indicates. Okay? All right, so we'll say I've got them all in. You're going to press enter. It's going to read your barcodes. And while it's doing that, you can come over to your little drawer here. You're going to have one of these tubes filled with blood and spun down. You're going to grab out a pipette tip. And you're going to have out a Barbie beer mug along with a pipette. Okay? This is spun down in your little centrifuge over in the other lab. And what you will do is you will take your pipette, suck off the plasma in here, and place it in your Barbie beer mug. Be sure not to hit any of the cells. You only want the liquid portion. If you hit any of the cells, it'll throw fibrinogen in there, it'll throw cells in there, and it'll throw off your results, and the machine gets mad and gives you funkiness. Okay? So that's why you use a pipette. Be sure when you go to use a pipette that you squeeze it before you stick it in the serum or in the plasma, because if you stick it in and then squeeze it, it's going to push that air in and mix your sample, and now you have to go respin. Okay? So pull out my sample, put it in my little Barbie beer mug. All right, and now it's telling me my next steps. So it says remove probe, insert tip onto probe, press on firmly, and replace probe. Here's your probe. You think I've done this a couple times. I probably said it word for word. That's bad. That should never be there. Okay? Take your probe out, take your new tip, place it on, push it on firmly, set it here, press enter. Now it says lower your tip into your sample, press the button, and you're going to press and release. Don't hold it. Press and release, you're going to get 1 beep. It's going to start to suck up your sample, so keep it in your sample. Once you get 2 beeps, you're going to pull it out of your sample, and you're going to grab a chem wipe. Okay? So you're going to put it in, press the button, release. It's going to go beep, suck up the sample, beep, beep, pull it out of the sample, and then it's going to suck up a little bit more and go beep, beep, beep. Then we're going to wipe off just the sides and stick it back in. Okay? Be quick with it. Don't go.
Because then it screams.
And then it gets mad. You're taking too long. And don't do this, because if you do this, this absorbs any of the material that's in here, and it will pull out excess sample and throw off the results as well. Okay? So wipe down the side once, stick it in. And then once you stick it in, it'll start to run. Now I'm not going to go through that whole process because I don't have a sample here to run. But once it is done running, it takes about 5.5 to 6 minutes to run. After it's all done running, it'll beep at you, tell you it's all done. You'll come over, press the enter button. It'll say, please remove your tip. Please remove your tip. We had to send this machine, this is actually a new machine, because the last machine got broke because someone in a class last quarter did not take the tip off. There was serum or plasma that got sucked up inside the system and ruined the system. So we had to get a brand new machine. Don't do it, please. Okay? Take it off, throw it away, place this back in, press enter that you did it, and then it will give you your results and print it here. Okay? Make sure that there is paper in your system before you press enter, because if there's not, then again, it gets mad and yells at you. Okay?
And there's paper in one of these drawers.
Yeah, I believe it's this one here. Yep, there's paper here. If you guys
This
run out
machine's
of paper in
constantly
there, let
yelling
us
at
know.
us.
We will
What
get
we
you
do
more.
extreme
Ooh.
fast.
Okay, good, there's nothing in that.
I got it right here.
Okay. All right. Once you are completely done, don't throw away your blood. Don't throw away your Barbie beer mug or your tube here. Keep them together until your sample is thoroughly and completely ran, because if for some reason something's wrong with it or you need to rerun it, you have your sample. Last thing you want to do is toss it and then have to go and redraw. Okay? Important. This tube can receive 1.2 mLs max. Okay? 1.2, 1.3, 1.2, 1.7.
There's a line on there? I think it says right on it. Fill to
Oh,
line.
no, 1.3.
1.3, it is
Yeah,
1.3,
other
thank
one's
you.
0.7.
Yes.
0.7.
Okay, 1.3. You want to have exactly 1.3 in here because you have the little donut in here that is your anticoagulant, and it will throw off your results and dilute it if you do not have the proper amount in here. That's why we make you guys draw 3 mLs. Okay? It's not just to torture you. It's for a real, true, good reason. Okay? Once your paper is printed, you will have also ran your microhematocrit tube, spun that down, got your PCV, gotten your total solids, write those results on there, and you will also ran your heartworm test, write those results on there as well. Bring it to myself, Megan, or Dr. Katie. We will okay the patient for surgery if something is funky, and we want to consult Dr. Katie about it. We will, and we will go from there to figure out what the next step is.